Upload the video to my YouTube channel because a lot of times people miss parts of what I'm saying. You'll find I'm working on this, but I talk very fast. So I'm trying to learn to talk slower, but you might miss something. And if you want to hear me speak about it again, you can actually go to the video and watch it again. So just put your name on the list if you want to hear it. All right, so oops, I'm not used to this right here. It's a prop I'll go through later. My name's Deborah Langhelt, Dr. Deborah Langhelt. I am a naturopathic doctor. And that's not very well known here in the state of Tennessee, so I'm going to go over what that is, so just hang tight. I also have my master's in public health. I'm a certified health education specialist and licensed massage therapist, so I have a lot of alphabet soup behind my name, and hopefully that gives me some credibility to talk to you here today. But okay, so naturopathic medicine is not based on the same premise as Western allopathic medicine. So when you go see your primary care physician in the state of Tennessee, you go see an MD, that's an allopathic doctor, and I'm a naturopathic doctor. So it's a totally different basis of how we approach health and longevity and disease. And, so there are 16 states and jurisdictions in the United States, 26 states and jurisdictions in the United States that allow naturopathic doctors to be licensed primary care physicians. Tennessee is not one of them, but these are the things that I was trained in. My education is nearly identical to regular allopathic medicine. So if you took the University of Washington and you took my university and you put them side by side, our curriculum for physicians, they look almost identical. Embryology, biochemistry, all the same things, physiology. The difference mainly is that I've taken a lot less pharmacology, so 1/3 of the pharmacology, because we are not about prescribing drugs, but I need to know about drugs so I can help you get off of them, right? So, and if there's contraindications with botanicals or other things. So we do take some pharmacology, but a lot less. And then we take around 9 botanical medicine courses, homeopathy courses, we take 9 nutrition courses, we take physical medicine courses. So we almost have an entire year additional training relative to an allopathic primary care physician. So I'm more trained than a regular primary care physician. We also have board exams, just like regular physicians. I admit those were very hard and stressful. And then we have extra board exams in order for us to work in some states. So I'm also board certified in pharmacology, so I can prescribe drugs in the states that I am licensed in. But once again, that is not, I'm not allowed to call myself a physician in this state. So here I can only act as a consultant, a healthcare consultant. So these are some of the things that I'm trained in doing, just like any other, primary care physicians and more, botanical medicine and other things. Okay, so here's a map of the United States. And this shows where we are licensed, where we are not licensed. If you look, we're dark blue here. Advocacy initiatives are ongoing, which means we're still working on getting licensed or being allowed to be licensed, but we're not there yet. Okay, so this is my disclaimer. I've already said it 3 times. I'm a healthcare consultant in the state. All right, and this is for educational purposes only. This is the name of my consulting company. And all right, so once again, naturopathic medicine, this really summarizes our approach to medicine. And we always start at the bottom and work towards the top, which means we're trying to establish foundations for health. So for example, regular medicine, if you go to the doctor, they have 2 primary tools in their toolkit, and it's drugs and surgery. And that's it. That's pretty much what they know how to do, and that would be high force interventions. We do that last. That's the last thing we try to do. So I can prescribe drugs in the states that I'm licensed in, but that would be not something that I go to first. Usually what we do is we start at the bottom of the therapeutic order. And what that means is, for example, you can be eating all the best food and exercising and doing everything right and you're not healing, and it might be because you have mercury poisoning or you have mold in your house, right? That is an obstacle to cure. It's something that's preventing you from healing. Even if you have all the right, building blocks for health, if you have something that's preventing you from healing, then that's an obstacle. So we start here with removing obstacles to cure, then we start building the cofactors for health and working up this order. All right, so now that you understand naturopathic medicine, that was my little Cliff Notes version. Now we're going to get on to today's lecture, which is how to prevent and heal from bone breaks. And so, this is what we're talking about today. It's extremely important for longevity. All right, so What causes fall? So this is a big list, but don't worry about memorizing it. It's sort of like my outline for today. These are all kinds of things that cause people to break their bones, right? It can be medication, and it makes you dizzy, and you lose your ability to sense your environment, so you fall more easily. It can be you can't see the curb when you're about to step off the curb, so your vision could be, and also hearing. You don't hear something, an environmental factor that might be causing you to fall. There's also pain. You go to step and it hurts, and then it causes you to fall. So all of these things are reasons why we fall. But there are 3 things that we're going to focus on in this lecture that I consider super high yield. And it's not just me considering it, this is evidence-based, so based on published studies, which you're going to see, that makes a huge difference on reducing your risk of having a bone break or a fall. And that's these 3 things right here: sarcopenia, osteopenia, and loss of proprioception. These are the 3 we're going to focus on. All right, so here they are. This is a summary slide of almost this entire lecture, is because we're going to talk about each of these 3 and how simple things you can do to improve these that will prevent you from breaking your bone, even if you fall, and also help you not fall in the first place. Okay, so sarcopenia is muscle wasting. So this is a weird picture if you don't know what you're looking at. You're looking at someone's thigh that's been cut in half, so it's just been cut right through, and you're looking at the muscle and the femur, the bone, right, of a young, healthy thigh muscle. And then when you look over here, you're looking at a sarcopenic thigh muscle. That means a muscle that has had muscle wasting happen. And so if you look, it looks quite a bit different. And we're going to go into depth on that. And this is a huge thing that happens to all of us starting at age 40 years old and on. We start losing muscle mass, and it's a huge risk for breaking your bone, and I'll explain why. Then there's also loss of proprioception. That's our ability to know where we are in space and correct. Our muscles automatically correct for it. Like if you close your eyes, how well can you keep your balance? And also, like if you stand on a wobble board, which I'm going to talk to you about here, can you stand on it and correct automatically? This is sort of like riding a bike. You correct before you know you're going to fall, right? Your body just automatically does it. That's your ability to sense where you are in space and make corrections. That's proprioception. And then there's osteopenia, which is our bones often get less dense as we get older, and there's a lot you can do about that. It's very, very simple and inexpensive. Okay, so let's talk about sarcopenia first. So this is considered an age-related involuntary loss of skeletal muscle and strength beginning in your 40s. So starting at 40, like I already said, and it starts decreasing more and more and more as we get older. So keeping our muscle mass is one of the most important things you can do for longevity. In fact, they have found in studies that the muscle on your thighs specifically, that's your quads and your hamstrings, are directly correlated with longevity, which is interesting. So, and I'm not just talking about arms and all the other, it's just your thighs specifically. And I've often wondered why. The study I read didn't explain why thighs in general, but I suspect, and I'm speculating now, that when you go to fall, you're going to fall, you catch yourself with your thigh muscle, right? So having enough strength on your thighs to be able to make the correction when you fall is really important to preventing a break, right? Also, that it adds extra padding, in essence, around your bones, all the muscle does, to prevent the impact from translating directly to your bone and causing a fracture. So we want to keep our muscle mass. And here's a slide that shows, here you are 25 years old at your peak of muscle mass, and then it just goes, here's 40 years old right here, here's 70, 80, you're going to be losing almost all your muscle mass. We're down to, 55% of what you had as a 25-year-old. So it goes down like crazy. And you want to see if you can stop that. That's our goal, right? And if you look at it, it's interesting because it doesn't just get smaller, like in terms of the diameter of your leg or the diameter. It's the tissue itself, the connective tissue increases and adipose tissue increases. It's like the whole consistency of the skeletal muscle tissue changes. And we want to try to reverse that or at least halt the decrease, right? So these are some of what I just described here, how it looks a lot more connective tissue. That's the white. All right, so we're going to keep going. So here's aging muscle, because this is way too many medical biochemical words, but so I'm going to summarize what they're saying here with all this is as we age and we get older, we have an accumulation of inflammation in our bodies, typically. This is generally speaking, we become more inflamed for a variety of reasons. That inflammation is what triggers the loss of muscle. Okay, so understanding inflammation in your body and decreasing it is something we're going to talk about. Okay, so what are the root causes of sarcopenia? That's muscle wasting. These are the four main ones I want to talk about today. And it's inflammation, which I mentioned, inadequate protein, gut dysbiosis, that's an imbalance in your gut, which we're going to talk about, and lack of activity. So we're going to talk about each of these individually. Okay, so first is inflammation. So many things lead to inflammation. But there are things you can do to counterbalance the inflammation that we're all going to be exposed to, because we're all exposed to stress. Our sleeping gets more difficult as we get older for many of us. So there's not a lot you can do about some of that, although I have whole lectures on optimizing your sleep and other things. But in the meantime, we can adopt an anti-inflammatory diet. You can do time-restricted feeding, which has been shown in studies to reduce your inflammation, get better sleep, reduce your stress, and track homocysteine. And so we're going to go through each of these. Okay, so how do we reduce inflammation? So now we're getting to the nitty-gritty. What do I do, right? So I've explained what happens and why. Now, what do we need to do to fix it? So do an anti-inflammatory diet, which typically the most inflammatory foods are gluten foods and dairy. Those are the top two. So if I had to pick the top two inflammatory foods, dairy foods and wheat, basically, right? Anything with gluten. So if you can slowly come up with alternatives for those kinds of foods, that's going to lower your inflammation and help you keep your muscle mass and prevent that degradation of your muscles. Also, time-restricted feeding, which is intermittent fasting. There's many ways to do intermittent fasting. I have done intermittent fasting for over 10 years now. Basically, I try to not eat from after dinner all the way till around noon. So I try to keep my feeding of myself from noon, which I start with lunch as my first meal, my breakfast, which is breaking my fast, right? And then I eat dinner around 5:30 to 6, and then that's it. That's my window of eating, which is typically around 6 hours, 6.5 hours where I eat. And that's my way that I do intermittent fasting, which works really, really good for me. Okay, this is a big one that I want to mention. Homocysteine is one of the biggest risk factors for fractures and bone fragility. It's brittleness and a tendency to want to break when you fall. Because little kids, they do stuff all the time and their bones don't break, but then when you get older you do the same thing and it breaks your bone. It's because your bone is more brittle, it's less dense. So what are measurable things we can look at to see if we are tending in the wrong direction? And the answer is homocysteine. And homocysteine is also a huge risk factor for heart disease. So I highly recommend the next time you go to your PCP and they're doing your annual blood work, that you ask them to include homocysteine. If they ask why, just say, I'm interested in it, I'm seeing a naturopath, and I'd like to look at it. Because allopathic doctors don't do a whole lot with homocysteine. So they'll tell you it's not a useful blood biomarker to check. Because it doesn't fit into their algorithm for drugs, okay? And so, but it is very useful for a naturopathic doctor, for us to know, and for you, yourself, to know what your homocysteine level is, because it increases your risk of hip fracture and heart disease. And it's very easy to correct with dietary interventions. So things you can do in your diet, which we're going to talk about. Okay, so I put this here so you can see the conclusion, which it says, these findings suggest that homocysteine concentration is easily modifiable by means of dietary interventions, and it's an important risk factor for hip fracture in older persons. So that's just what I said, right? And I had it highlighted, but for some reason the highlighting is not showing up. That's really weird. Okay, so homocysteine. What are some ways we can decrease our homocysteine naturally? Well, the answer is right here: folate, B12, and B6. And really, I want you to look at B6. If you don't remember anything else, B6. When you think homocysteine, think B6, vitamin B6. That is a supplement worth taking if your homocysteine has been shown to be high when you have your lab values tested, okay? It's also, remember, if your homocysteine is high, not only are you at a higher risk of having a bone break, but you also have an increased risk of heart disease. So it's worth lowering, and it's super easy to do. Okay, so let's keep going. If you look, 28% right there. 800 mcgs of folate has been shown to lower homocysteine by 20%, B6 even more. So there's tons of studies out there on that. I have so much to cover today though, I'm not going to show you every single study. Okay, another thing is we're not getting enough protein. So people, as we get older, we need, in some ways, a lot of us need more protein because we're not absorbing the protein we eat. That's the problem, okay? So why are we not absorbing the protein that we eat? And the answer is because many of us, as we get older, I would say most of us, our hydrochloric acid in our stomach starts to decrease. And a lot of times that's because we take famotidine, or we take Pepcid, or we take Tums because we have heartburn several hours after we eat. So we take over-the-counter stomach acid suppressors. It's one of, as a naturopathic doctor, I am very wary about telling anyone to take stomach acid suppressors. It's one of the last things you want to do, even for heartburn. Because typically the reason people have heartburn several hours after they eat is not because their stomach acid's too high, it's because it's too low, okay? So what happens is, when I get people off of stomach acid suppressors, I have them increase their stomach acid right before the first bite of a high protein meal. And I can do this with apple cider vinegar, but you can also take betaine supplements. And so before your first bite, you take some apple cider vinegar gummies or a little shot glass of apple cider vinegar, and then you eat your meal. You will digest your protein a lot better, and then several hours after you eat, you'll find you don't have heartburn. Okay, so it's too low of stomach acid. And then what happens though is once you start taking stomach acid suppressors, you've started a vicious cycle, catch-22, where you can't get off of them because now you're not absorbing B1, which is thiamine, and you're not absorbing zinc from your food because you don't have the stomach acid to start that first step in digestion, right? And so those are the cofactors to create stomach acid. So not having stomach acid means you can't create your own stomach acid, right? Because you're not getting the cofactors from your food. So you have to break this vicious cycle by getting off of the suppressors and increasing your stomach acid before you take your first bite. And then slowly over time, you'll start digesting your protein better. Your kidneys will work better, you'll have more energy, you'll start losing weight, all kinds of things starts happening. All your blood biomarkers will change. This has happened to many, many of my clients. Okay, so you want to digest your protein and you want to get enough of it so you can build and maintain your lean muscle mass. So protein's a big one. All right, so I talked about drinking apple cider vinegar to kickstart your digestion. You can also take digestive bitters. How many of you heard of digestive bitters? Do you know what that is? Okay, so digestive bitters are pretty awesome. I love them. It's a botanical blend, and you can get them almost in any natural food store. And they're a tincture, so it's a tincture of herbs that are bitter herbs. Gentian is the primary one, but there's many other herbs. And then you just put a couple dropperfuls in your mouth before you eat, and it actually causes, because of the bitter taste on your tongue, it causes a physiological reaction for your gallbladder and your stomach, the parietal cells and the chief cells that are in your stomach. They will instantly start creating hydrochloric acid and releasing bile, okay? So it's like you're preparing yourself using your own body, not taking a supplement, to digest your protein better, right? So it works great. I used to carry around with me a little bottle of bitters that has a spray thing on top, and I would just spray like 3 to 5 sprays on my tongue right before I started eating to help me digest my protein better. Okay, so how much protein is what we need? You know, you got to know how much it is, right? So like this particular thing is showing a woman of 160 pounds, but you also have an example. So this is an example: 160-pound woman, 200-pound man. This is how much they would need. Okay, and you can calculate this out. So I have some equations here in the next slide. So if you're 120 pounds, so take your weight and convert it to kilograms, multiply it by 1.5, and then multiply it by 2.0, and this would be the range. That's your range between 82 and 109 grams of protein a day is what you need to be striving for as someone who is 45 years and older, I would say, in order to retain your lean muscle mass. So if you look right here, they're doing the calculations down here as well. So that's 160 pounds. That's how they got on the previous slide the numbers they got. So you got to convert your weight to kilograms, multiply it by each of these two, and then that's your range. And so then the next question you should be thinking is, well, I can't visualize 82 grams of protein, or what's 100 grams of protein look like, right? So that's where we go to the next slide. So here's a list of high protein foods. This is 20 grams. So this little piece of salmon is 20 grams. So that means like for a 120-pound person, which is approximately my weight, right? I would need 5 of these a day if I wanted to be on the upper end of protein, right? In my range of 82 to 100, I would need 5. That's a lot more protein than people realize, right? Now you can take protein powders and shakes. There's many ways to get protein, but these are some. I love cottage cheese, so that's 11 grams. So you can do it with vegetables, But the point is, you need to be mindful of how much protein you're getting in your diet as we age. Especially if you're an athlete or you're doing hikes or something like that, you're going to need to go on the upper range, because remember there's a low to high. You want to be on the upper range. Okay, but no matter how much you eat, it's going to be irrelevant if you take stomach acid suppressors, right? Because what happens is a stomach acid suppressor, that hydrochloric acid is the way our body breaks the peptide chain. So protein is a peptide chain. And you need to break those peptide chains so that way your intestines can absorb that protein. And if you don't do that first step, if you skip that first step, then you're not going to absorb that protein. So you're like, well, what happens to it? Well, you pee it out, which means your kidneys are going to be really unhappy. Okay? Because what happens is, and so that's why you see a lot of people, as they get older, their GFR, which is the glomerular filtration rate, which is a lab marker you do on your annual labs, your GFR that shows your kidney health gets lower and lower and lower and lower, right? And the reason why is you're taking stomach acid suppressors. And so your kidneys are having to pee out a ton of protein, right? And so it's really hard on your kidneys to have to filter out all that undigested protein. And it's a strain on your kidneys, and it starts killing your kidneys, right? So I've reversed a lot of people's chronic kidney conditions simply by healing their stomach, okay? Healing their stomach acid. Okay, so I wanted to make that point because it's important. Okay, so then the next thing, remember there are 4 things you can do for muscle wasting. Another one is create balance in your gut. So the way I like to think of gut dysbiosis is, dysbiosis just means an imbalance. So an imbalance in your gut. And so we all are just filled with bacteria. We have good bacteria, we've got bad bacteria, and I don't even like to call it bad, okay? Because we have Staphylococcus aureus, we got all kinds of what you would consider a bad bacteria on your skin, but it's not bad when it's in balance with all the other bacteria. It's only when the imbalance happens, and there's more of one than it's supposed to be, that you start having problems, right? So we have like E. coli, we got all kinds of bacteria in our colon, and the primary bacteria that causes urinary tract infections in men and women is E. coli, and that's just a normal bacteria that resides in our gut, but it wreaks havoc on our bladder and causes urinary tract infections when it gets into the wrong spot, right? So we have little microbiomes. All of the microbiome in our skin is different than the microbiome in our mouth, which is different than the microbiome in our genitals. Like, we have different microbiomes in our whole body. Well, our gut, which is our intestines, basically once it empties from the stomach, we get our small intestines and our large intestines, has its own microbiome, and you have to keep that in balance in order to get the right nutrition and to keep inflammation low, so that way we don't have that high inflammation environment that leads to high homocysteine, which leads to our muscle wasting, right? So we're trying to figure out why, when we age, does our muscles go down and down and down? And it's inflammation, and you can deal with inflammation by making sure your gut has good bacteria. So what happens is, instead of, like, allopathic medicine will say, let's kill the bad bacteria, kill, right? Let's give you a drug to kill it, right? And we naturopaths were like, no, we're just going to bring in reinforcements. We're going to bring in the good troops to balance out, sort of like bringing a predator into an environment that is overrun with foxes. You bring in the fox's predator to try to keep, right? Instead of killing all the foxes, you bring in the predator. That's what we as naturopaths do. So the way you get your gut in balance is you take probiotics. Now, something that people don't understand is when you take a probiotic pill, it's very temporary. Studies have shown that, yes, you're inoculating your system with new, good, beneficial bacteria, but it doesn't stick. It won't stick. The instant that you stop taking probiotics, your body and your gut will revert back to its original microbiome profile, right? So really the only way to permanently change your microbiome is to take probiotics forever in pill form, and I don't like to recommend that. Instead, you have to change your diet, because that's what feeds the bacteria in your gut, is what you eat. So the number one way is to change what you eat. So I recommend people eat a fermented food of some sort every single day. So whether that be kefir, have you heard of kefir? It's like a fermented yogurt type drink, right? Or sauerkraut, or kimchi, or kombucha, some kind of live food is worth eating every single day. Even if it's just a few bites, that's enough to change your gut microbiome to reduce inflammation. All right, so here's some strategies to support, creating balance in your gut. Number one, you can go kill the bad bacteria. So if you want to try to kickstart your system, olive leaf extract is really good, but I have a few other ones listed there. Oregano oil extract and berberine are also really good. This is olive leaf extract right here. Here is berberine. These are natural substances, botanicals that we use that are very, very effective at very quickly getting rid of an overpopulation of the not friendly bacteria in your gut. So we use berberine especially with people who have SIBO. Have anybody of you heard of SIBO, which is small intestinal bacterial overgrowth? A lot of people have SIBO, and one of the biggest signs of SIBO is you have a lot of flatulence after you eat, or you have a lot of burping that happens like an hour or so after you eat. And that means the non-beneficial bacteria are proliferating too much, and you need to lower them a little bit, right? And so you can use oregano extract and olive leaf extract and berberine to help create balance. But you don't have to take it forever. It's just to try to get the population down a little bit of the non-friendlies. And then you have to eat probiotics daily. So sauerkraut, yogurt, kefir, kimchi, pickles, live pickles though. They can't be the ones that are not in the refrigerated section. You go to it has to be live, and it should say live on it. So go to the refrigerated section of the grocery store and get the live pickles. But, one pickle a day, or just mix it up and have a different kind of live food daily. Very, very good for your gut. Don't eat on the run, and this has to do with your parasympathetic and sympathetic nervous system. How many of you heard of fight or flight and rest and digest? Have you heard of that? Okay. Well, there's a reason it's digest, rest and digest, because you cannot digest your food when you're in the fight or flight state. Okay. So if you're driving your car and you're thinking about 100 things, you are in sympathetic mode, which is fight or flight. And all the blood that supplies and controls the release of hydrochloric acid and bile and all that is all being suppressed during fight or flight when the sympathetic nervous system is activated. So it's important that when we eat our food, we're very relaxed, and our parasympathetic nervous system, which is rest and digest, has been activated so we can digest our protein, right, and absorb our B vitamins and all of that. So try not to eat on the run. I know it's impossible not to sometimes, but it makes a big difference. Okay, so what are some other things that you can do to retain your lean muscle mass, and build it, right? And a big one that has lots of studies based on it is astaxanthin. And so astaxanthin has some other little bonus things too that I think makes it worth looking into. But it's been proven in many studies to be extremely effective at helping you retain your muscle mass. And it's a natural internal sunscreen. So in the summertime, if you're going to be out on the lake or whatever, or if even your kids or grandkids are going to be out on the lake, I highly recommend everyone has this in their medicine cabinet, simply because it's such an effective internal sunscreen. You will not get burned if you take this. It's amazing. And it heals your vasculature and all kinds of other side benefits. But for this lecture, I'm going to focus on one of its benefits, which is it helps prevent muscle wasting, which is fantastic. All right, and then glycine is another one. It's also multifunctional. Glycine is just an amino acid, which means it's a peptide that comes, it's a protein, right? People ask me, like, but what is it? Like, what actually is it? I'm like, steak. Because it's meat. It's a protein that we often find in meat. One of many proteins we find in meat. pork rinds, you know those crispy pork rinds, has a very high natural glycine content. So if you like pork rinds, I'm not against you eating them, okay? Especially before bed, because the glycine is going to help you sleep and it's going to help you build muscle mass. I don't like pork rinds, so I get this right here. This is a powder that you can buy. It has a little scoop in it, and you just put a little scoop in your chamomile tea and make yourself a little unwinding ritual at night and drink it. It will help you sleep, which I'm going to show you some studies, but it will also help you build lean muscle mass. And it's sweet, it tastes delicious, okay? So it's a very, very good thing to have. Also, just as a side note, glycine prevents a lot of, as men get older, their prostates get bigger. This is a normal thing, and they end up having increased urinary frequency at night, and they have increased urinary urgency at night, right? And throughout the day, glycine has been proven in studies to dramatically and significantly reduce that. So especially for elderly men and men who are over 50 years old, I highly recommend they take glycine as just a normal supplement. It'll help them retain and build lean muscle mass. It's in all the bodybuilder formulas. If you look, it's an ingredient, right? But it's also sweet, and it's perfect to help you sleep and help with urinary issues. Okay. But lean muscle mass is why we're talking about it today. All right, so here's the effects of astaxanthin on the protection of muscle health. So here's one of the studies that talks about that internal sunscreen. That's really fantastic. Let's see here. Here's a study talking about how glycine protects muscle cells from muscle wasting, which is what I was talking about with here, right? But I use it for sleep, believe it or not. It's great for insomnia, which is why my main issue. Okay, here's just a slide that shows it's been used for muscular dystrophy and all kinds of things because it helps your muscles relax. It's basically really good for muscles, glycine. Okay, so all right, so here's just, I wanted to put this in here because having better sleep also lowers your systemic inflammation in your body. And remember, if we can lower inflammation, we will keep our muscle mass, right? We'll keep our muscle mass. So you want to sleep better, which is why I chose glycine, right? Because it helps you, it directly helps build your muscles, but it also helps you sleep, which lowers your inflammation and keeps your muscles, right? So basically what it does is it helps you reach this deep sleep. So down here is called slow wave sleep. So this really deep sleep, this is how that's an ideal sleep cycle, what you see here. We go through different types of brainwave patterns as we sleep. We cycle through them as we go to sleep. And if you look, our deep sleep is very early in the night, and it's our first 2 sleep cycles. And as we get older, we don't reach it. We actually skip it. And the interesting thing is slow wave sleep is like a pressure washer for your brain, and it will remove the amyloid plaques and prevent Alzheimer's disease. So if you're skipping this, if you're skipping your deep sleep, which many of us as we get older do, then you're not cleaning out your brain each night to prevent cognitive decline. But this lecture is not about cognitive decline. We're simply talking about lowering inflammation, and it will do that. If you can get into deep sleep quicker and earlier, you will lower your body's inflammation and cause a million different beneficial effects, including keep your muscle. All right, so, and also glycine helps you not be sleepy in the day. So this is just saying that you'll be more energetic during the day, you won't feel lethargic, you'll have a lot more energy during the day. So another reason why glycine is great. Less fatigue during the day. So if you have chronic fatigue or fibromyalgia or anything like that, glycine is great. Okay, so now we're finally on, so we just finished muscle wasting. We got 2 more to go, right? We've got bones and proprioception still to go. Okay, so osteopenia and osteoporosis is basically describing how our bones lose density as we get older. And there's a lot of reasons for this, but basically our bones are not this static tissue in our bodies. Okay? Our bones are highly dynamic, and they change constantly depending on the stresses we put on them, right? We have amazing bodies, extremely adaptable, which should make all of us feel really good because we can change it. We can change our bodies consciously if we just know the physiological triggers to do it. Okay, so what happens is when we're young, we're jumping around all the time, and so the main way we increase bone density is when our bones feel, when they sense an acceleration. Well, so what is an acceleration? An acceleration is this. Jumping, gravity, right? Jumping, specifically jumping. That is an acceleration. When your bones sense an acceleration, they will build bone, specifically in the porosities. Because what happens is we have two kinds of cells. Well, we have many kinds of cells, but there are two that are relevant for bone strength. That's osteoclasts and osteoblasts. And osteoblasts build bone. I call them the bone builders. Blasts, builder, BB, right? And the clasts are the chewers. So they're the bone chewers. And so we have to have both. We are constantly chewing up our bone, and we're constantly rebuilding it. All the time, constantly. And so I actually have a little video I was going to show you, but I'll get to it. So once you hit a certain age, you know, I've had like 3 DEXA scans because I'm interested and I'm a physician, but you know, you can have a DEXA scan whenever you want. And a DEXA scan is just simply a way to get a measurement of your bone density. And it's good to have a baseline so you know what, even if you're younger than, you know, if you can be 40 years old, do it, get a baseline so you know. So then when you get older and you do another one 5 years later, you have a baseline to compare it to, okay? And people who are lighter weight have less dense bones naturally. So if you are a obese woman, right, or man, you will naturally have stronger bones because every step you take has more weight on those bones, right? So it's lighter weight people, you know, who have more of an issue, and also usually darker skinned people do not absorb vitamin D through their skin the same way, and so they will have more tendency towards osteoporosis. But smaller, lighter weight women are the more at risk. Okay, so recommendations for who should get a DEXA scan. It says breaking a bone after age 50, family history, but really we recommend it as physicians, what we're trained is 65 and over, but I recommend anytime you feel like you want to get a baseline, go for it. It's good to start tracking it. Like I said, I've had 3 of them, so just because I want to know. I'll be turning 50 this year. Osteoporosis doesn't, I don't think, run in our family. I'd have to ask if one of my grandmothers had it, but you know, I still wanted to know. And interestingly, I did learn something. The first one I had showed that I was not, I did not have I was lower than average for bone density for a 46-year-old is when I first got mine. And so since then, I did a lot of research, and now I am above, way above, and I made that since, because my first one was 46, so in 4 years, I have been able to make a huge difference in my bone density, according to the scans. And I did a third one just to make sure, you know, that it wasn't just a fluke, because there's weird tolerance issues in these scans. And I'll tell you, I'm about to tell you what I did to increase my bone density, and it's virtually nothing, which is amazing. Okay, so, all right, so bone flexibility and bone density. So what happens is, when you go to the doctor and they say, you have osteopenia or you have osteoporosis, the first thing they usually give you is a bisphosphonate. And the bisphosphonate is a drug that basically prevents the osteoclasts, that's the chewers, the bone chewers, it kills them, it inhibits, it makes them not be able to do their job. And instead, the osteoblasts, the builders, will keep building, so it builds on top of bad bone. So in other words, it works, your bone density gets bigger, but it's not healthy bone. It does not make healthy bone, right? Because, you know, if you have little microfractures, I mean, there's a reason why our bodies have chewers and builders, right? It's because we need to rebuild our bone healthy, and you can't just be putting plaster on top of bad plaster on top of bad plaster, right? Because 3 layers below the bad plaster, it's just going to break and fall off, right? And then you're going to have, so it actually increases your risk of a fracture. It increases your risk of a fracture. That's crazy. So then why do they give it to you? Heck if I know, right? Because like it, you know, the whole reason you think they're doing it is to reduce your risk of a fracture, but they don't say that. They say, we're going to help you increase your bone density, and the assumption is that's going to reduce your risk of a fracture. That has not been shown to work though. Okay, so I don't want you just to increase your bone density. I want you to have strong bones that are resistant to fracture. Okay, all right. So what are some supplements that you can do that will also help with your bone density? And the big one is vitamin D. Remember I said dark-skinned people have a higher risk of osteoporosis? It's because they can't get the vitamin D from the sun. Because what happens is your skin, when your skin is exposed to the sun, it triggers a physiological process that creates vitamin D, and that's a Cliff Notes version there. But and people think, oh well, I need to get it through my eyes. No. You want the skin covering your long bones has to be exposed to the sunlight. Okay, so it's not through your eyes. That's not the majority. So if you're going out in the sun and you have pants on like me, that's the longest bone right here that I've covered up, my skin. The skin has to be exposed. And no sunscreen. I mean, take your astaxanthin if you're light-skinned so you don't get burned, and then you got to expose your skin. Now, most of us aren't going to get enough. It's just the way it is. And so I take a vitamin D3 supplement. How many of you take a vitamin D3 supplement? Okay, that's fantastic. For most of us, I recommend that we do that. Unless you're in the summertime, you're always out gardening, then you probably can stop taking it for those months of the year that you know you're exposed, right? But another thing, vitamin D is so effective at mobilizing calcium, right, in your bloodstream, that it will raise your risk of heart disease. So I'm gonna tell you this again. A lot of people go to their doctors and like, oh, I checked your vitamin D, and I got to give them credit. Functional medicine doctors, they check and, oh yeah, your vitamin D is low. It's like 10 or 15. We got to get it up above 30, So I want you to take, 8,000 or 10,000 IUs of vitamin D3. And like, okay, great, it's cheap, it's great. It's a little tiny little pill, you can take it, right? Problem is, it works. It works really, really good. And so now, when you test your calcium in your blood calcium goes way up. Well, that's a problem, because calcium is what causes hardening of the arteries, and it causes plaque in your arteries, and it increases your risk of heart disease. So what happens is, you don't want serum calcium in your blood higher. You want that calcium to go to your bones, right? So there's 2 steps in the process. Step 1 is get the calcium going. Great, now you've got it in your blood. Step 2, something has to take that calcium and put it in your bones where you want it, and that's vitamin K2. Okay, so don't ever take a D3 supplement unless it has vitamin K2 with it. And nowadays, supplement manufacturers are starting to get a lot smarter, and they're incorporating K2 into their D3 supplement. And there's a couple kinds of K2 out there. The one that's best for bone health is called MK7. Okay. So you want vitamin D3 / K2, and then in parentheses, MK7. That's what the supplement needs to say if you really want it to be effective for bone health. Now, a side benefit of this is the K2 is like a chaperone. It sees the calcium in your blood, and it's like, oh, there's calcium. It says, here, let me take your hand. And it takes the hand of the calcium, because calcium is very sticky. It's +2 molecularly, right? So it takes the hand of the calcium, and it escorts it to where it needs to be. And it really likes calcium, so it's going to stick to calcium everywhere. Well, if you have calcifications of your arteries, or calcifications in your heart valves, or calcifications because you get kidney stones all the time, calcium oxalate crystals in your kidney, that K2 is going to find that calcium, and it's going to chelate it. It's going to bind to it and pull it out. So that's a nice side benefit, right? It's going to pull calcium out of your arteries and everywhere else that calcium should not be, and it's going to take it to where it needs to be. So it's an absolutely fantastic supplement is K2, MK7 specifically. All right, so if you want to know a lot more about what I'm talking about and go into depth on it, this woman's fantastic. Her lectures, she's very friendly, easy to listen to, and she talks about what I'm talking about, okay? And she gives you a lot of more information, and all of you who signed up for this PowerPoint can click on this and watch this little YouTube video. Okay, and we might watch a little bit of it if I can get far enough. Okay, so remember I told you earlier, I said that what signals the osteoblasts and clasts, that's the chewers and the builders of your bone, to become active, to start building bone and all the porosities. And I said it's an acceleration, right? That's what I said. Well, a lot of us are like, oh my gosh, Deb, I'm not going to be doing jump roping. I'm not going to be going jogging. I broke my hip and I broke my knees, and my knees hurt and my hips hurt and everything hurts, and I'm not going to be jumping, right? I avoid jumping at all costs. So, interestingly, the astronauts, when they go up in space, they can't jump either, right? Because they're floating around in an anti-gravity environment. And so they all get osteoporosis. Every single astronaut who's ever gone up into space has osteoporosis. Because our bones are dynamic living tissues that instantly respond to our environment. And if our environment doesn't have any gravity, then we don't need any bone density. And so immediately the osteoclasts start chewing up bone within 24 hours, right? So, it's irreversible. They're trying to figure out how to make it, to reverse it, But one thing that they've learned in all their time with the astronauts is you can stimulate and, I don't want to say trick, but convince your osteoclasts and your osteoblasts in your bone that they are experiencing an acceleration without gravity, right? And the way you do that is with a whole body vibration plate. So and I'll demonstrate this later, but this is my ancient one. I've had this forever, and I'll turn it on. It's very noisy. You can get better ones now that are a little bit more quiet, and you've got to put like a little yoga pad under it or something so that way it won't shake your whole house, but you'll see in a second. And when an acceleration, when you stand and gravity is acting on my body right now, and I'm standing on a vibration plate, and if I move it to the right hertz, right, 20 hertz or higher is what you want, really 40 hertz. There's a lot of different hertz for different things. That's the frequency of the vibration. What you're seeing is, and I'm going to demonstrate here, but if you look, it goes back and forth, but it does it so fast that you can't feel it. You can't feel it going like this, right? Well, what does your bones feel when that's happening? Your bones feel like you're jumping. It's micro accelerations, right? So you can, in space, they'll put a band, like a resistance band, and push themselves onto the plate and then let it vibrate, and that mimics jumping, which will keep their bones dense. 10 minutes a day on a whole body vibration plate, just standing on a whole body vibration plate, will help stimulate your bone density to increase dramatically. Then if you can put more gravity on yourself while the plate's moving, it will be even more effective. So like, this is what I use. This is a little, I think it's 7 pounds, but you can get whatever kind of weight you have, get a water bottle, whatever, and then I do knee bends, right? And then I hold it and I come up, because it's also been shown to increase your muscle mass. And remember I said the muscle on your thighs are directly correlated and associated with longevity. So holding this, actually, your muscles in your bones and your joints in your knees feels that you get a lot more benefit. It will heal your joints. It rebuilds your knee joints and your hips and everything. So one of the simplest, most inexpensive ways to increase your bone density and heal your knees, your knee joints, and your ankles, and your hips, all of it, is use the whole body vibration plate. Okay, so we're going to keep going, and I will demonstrate that. Well, maybe I'll turn it on now so you guys can see it. This floor is completely level, so it's extra noisy, but you got to put it on a nice flat surface. Okay, hold on. And start. This one has 20 speeds, so I always go to the highest. Yeah, it's going to... That's it, right? Like this, hold it, stand up again. We put it in our basement where there's a nice concrete floor, on a piece of carpet, and then it doesn't make as much noise, right? So you can watch TV. The new ones now don't make as much noise, and you can watch television easier without all this noise. This is extra noisy on this floor for some reason, so it's not usually that noisy. Okay, weight training also helps, and it's for the same reason. You want to load. You have to put a load on your bones and that means weight for your bones to be stimulated to fill in the porosities. Okay, and then jumping, jogging, and then jumping on a rebounder. So this is what I use, and this is my favorite one because it's silent, right? It doesn't make that squeak, squeak, like someone do, and it makes you jump pretty high. You can get ones that have a little thing to hold on to, which I recommend, and but your bones will still see this as an acceleration, and it also is really good for cardiovascular health and joint health and all kinds of things, because it's a great exercise. It's probably one of my best exercises I recommend for people is use rebounder. And you only need to do it for 5 or 10 minutes too. And you can do all kinds of fun stuff on it. Tuck jumps, and you can do all kinds of fun stuff. They have YouTube videos. I'll put on a YouTube video and I'll follow the little person doing the YouTube. Okay, so whole body vibration exercise and postmenopausal osteoporosis. So there's a lot of studies out there that prove the efficacy of what I'm saying about this whole body vibration plate. So there's that. Here's the astronauts in space using a whole body vibration plate with their bands holding them down, and all their exercises they use a whole body vibration plate with, and for their bone density. You can usually, a lot of times gyms now and even physical therapy offices, you'll see these you can get a decent one for $200, right? And you can get one that I don't like as much, but slimmer, for $100. So you can get them from as low as $100 and then spend a lot more on them. But I would say you can get a great one for around $200, $250. You can get a really good one. Okay, so here's rebounding, and so I talked about bisphosphonates. That's what the doctor will give you for osteoporosis. And so what I'm showing you here's the osteoclast. This is the bone chewer, and it literally chews up the bone as it moves. I'm going to show you guys a video. And then, and what happens is bisphosphonates that's the bisphosphonate, basically inhibits it and makes this cell die. So it's killing the osteoclasts, right? And so that way, they can't do their job, and so you're just putting the osteoblasts, which are the builders, are just going to build new bone on top of bad bone, okay? All right, so here, I have it. Let's see if it works. That would be great if you guys can see a little, oh, nope, hold on, go back. I'm gonna show it to you because we have a second or two. And I think this computer, let's see here, I had this one. Yeah, let's do this one. All right, so what you're looking at here, I don't think there's any volume, so it doesn't matter. But what you're looking at, if it keeps going.
Bone is a dynamic tissue that is continually being
Maybe I
built,
did volume
broken
go.
down, and rebuilt in a process called bone remodeling. Bone tissue is broken down and resorbed by multinucleated cells, known as osteoclasts.
So there's the
These
bone
cells are
tumors.
derived from monocytes, which originate within bone marrow. Osteoclasts play an important role in liberating minerals and other molecules stored within the bone matrix.
You need them. You don't want to kill them.
Bone tissue serves as a repository for vital minerals, including calcium phosphate and various biologically active molecules, such as growth factors. The release of calcium from the bone can play a role in maintaining its homeostasis within the body. The cells responsible for building new bone tissue are known as osteoblasts.
Those are the bone builders.
Osteoblasts are thought to be derived from cells found to be associated with blood vessels. Once active, they start to produce the organic component of bone, osteoid, which is predominantly made of collagen. Minerals start to...
All right, so that's good enough. I'm going to stop it there anyway. So the point, I guess, I was trying to make with this little video is that you don't. It's not in your best interest to kill the osteoclasts. They serve a huge purpose. They release minerals from the bone that you need. But our bones are our biggest reservoir for minerals and calcium, and we need calcium. Every time you contract a muscle, calcium does that. We have calcium stored in what's called the sarcoplasmic reticulum, and it's released every time you contract your muscles. So we use calcium everywhere, and we have to have a huge reservoir of calcium to choose from, and we get that from our bone. But you're not going to get it from your bone if you can't liberate it because you're taking bisphosphonates, right? So rather than taking bisphosphonates, use a whole body vibration plate, right? This has multiple benefits. Okay, so now we are finally past bone. So we've done muscles, sarcopenia, we've done osteopenia, and we've got 7 minutes left when we're going to talk about proprioception. And that's your ability to sense where you are in space and keep your balance and correct automatically without thinking about it, like an unconscious. Now the thing is, we are constantly rewiring our neural circuits in our head, you know, and that connects with our head and our muscles, and we can practice and improve our ability to be proprioceptive, right? It just takes practice. So I have a whole bunch of stuff here that are my own toys. This is a fun one. I use this for many things. It costs like very cheap. I think it's $12 on Amazon. They call it a wobble cushion, okay? And the main reason I tell my clients that this is a good thing is for spine health. So you put it on the chair. I like to put the grippy things down because I don't like them on my butt, right? And if you have spine pain or back pain, you want to just move your hips one way and then the other way. And if you look, my head's pretty much in the same spot, but my hips are moving. That's going to lubricate every single vertebrae in your vertebral column and relax the muscles that support your back, and it reduces pain tremendously. So every time I'm sitting at my desk working on this presentation, for example, I sit on a wobble cushion, and it will relieve your sciatica, your hip pain, all kinds of stuff. But you got to do it. It's all consistency because we are dynamic beings and we get used to things, but your spine has to know that it can move. And it will definitely relieve back pain. But I'm digressing because that's not why I'm bringing it up today. Today I'm bringing it up because of proprioception. So you can get 1 or 2 of these, or one. And if you have a standing desk, you know, my desk is a variable desk, and I have a crank that goes up and down, and you can stand on it and move around, and it makes you lose your balance a little bit, right? But so you're correcting. So I'll be standing on my computer, and I just move and jog, and without even knowing it, my brain is making neural pathways to help me figure out how to balance. Does that make sense? So it's super easy to use when you're standing up, right? And you can control, there's a little thing on it where you can, that's where you inflate it. So you can put as much air in it as you want, and that's what you do. So super, super cheap, inexpensive thing I think everyone should have for the back health primarily, but also to practice proprioception. Then, if you decide you really want to be even more fun, I have these things called balance pods, right? And I find these difficult, so I need to practice more. But you can put them all over on the ground. You can put them this way or this way. I like to use them this way because it's easier on my feet. I won't use these shoes. But basically, you step on them and you just try to learn to balance, right? And then you just walk on them. And you only have to use these for like 2 to 5 minutes a day, every other day, and you will build your brain to muscle and ankle joint, and knee joint ability to correct yourself when you're going to fall. So the next time there's some stuff, you're going from the North Post Office and you you fall off the curb, and your body feels your ankle rolling, you will correct yourself faster and more effectively if you've practiced this at home regularly, right? So that's building your proprioception. So you wanna improve your proprioception. And then the last thing that I do, and I've done this for years too, because mainly I'm hyperactive and I gotta keep myself from being bored. But when I was in medical school, COVID happened. We had a lot of classes online, so it's like all in front of the computer all day long, taking these classes if I wasn't at the clinic. And so this is a walk. These shoes aren't good, so I'm not going to use them. But I would stand on a wobble board at my standing desk, and I would just move around. Sometimes I just stretch my calves, and I got really used to just standing there. And it's good for your spine because you're moving and you're having to correct, right? But you improve your proprioception a lot by using things like that. And my desk is right here, so I could hold on to it, right? But this is a more advanced proprioceptive thing to do. It gets easier really quickly. It's amazing. Like you first start and you're like, oh my God, I can't do this. And then within like 1 day of using it, while you're at your standing desk, you'll find it gets a lot easier. And that's the whole point, is you need to build this ability into your body and your brain. And this one, you can take it off and make it higher. And so the higher it is, the more wobbly, right? So this one can go several different heights. So this one's, I find, real fun. Okay, so let's keep going. So yeah, practice balance. Another thing is I know that my mom does chair yoga like once a week at the, what's the name of the place you go to?
Take Charge Fitness.
Take Charge Fitness. And she's talked to me about what they do in chair yoga. It's all evidence-based. Like they have fantastic instructors there. I really love some of the stuff that she does at Take Charge Fitness. It's exactly what I would be recommending as a physician. So look into that if you want. They have great instructors. There's a test that we do at the clinic for people who are at risk for bone breaks. It's called the sitting rising test. I think any of you who were here last week, I talked about it, or not last week, last month. And basically, it's just, can you stand here, can you sit down, right? And then can you stand back up again, right? Okay, like that, right? That's it. And you get points taken off. And it's hard with these shoes too. These are slippery. But you get points taken off if the person uses their hand, if they